since I've been losing this weight, the only symptom I've had I don't like is my shoulders are now bothering me for some reason. And I stopped doing some of the exercises out there because of it. And that was kind of like annoying.
Okay.
But I don't know why that happened. And it never hurt me before like
Before?
it does. Yeah.
Have you done any posture analysis?
No.
Why don't you schedule that?
Okay.
Yeah, there's no charge for that. You can, we can get that evaluated. And then we can tell you if there's anything that we can see that could be corrected.
Okay.
Okay, perfect.
I didn't know much about what the talk was about. I was just encouraged to come, and then I was told they're trying to get all their people to come and hear new health facts and information.
Excellent. Are you personally interested in anything in particular? You want to hear about
No,
something? Are you wondering about something?
No, basically I'm here for the exercise program, and that seems to be working for me.
Beautiful. Okay.
Well, I'm fairly new, so this is the first time I've been to any of your lecture conferences, so, and was encouraged to come and worked out finally, which is great. And I've, have, been doing the exercising program here as well. So nothing in particular, I guess, of interest except for just overall nutrition, especially kind of age, kind of related pieces with it, and just moving forward in a healthy way.
Excellent.
Yeah, I've been in this plan for 4 months and I'm really happy. I just wanted to know some more information. It's my first time, for the lecture.
Anything in particular that you want to know? Anything that you feel that you have not learned enough of?
No, everything's great, yes.
Okay,
Thank
perfect.
you.
I've had in the last year two foot surgeries, one on each foot, and as a result of that, slowed down, and I put on weight, and I need to get back on track to lose weight. So that's why I'm here.
Excellent. Nothing in particular that you want to learn about? Something you heard recently in the news, or?
Well, their diabetes runs my family, so that's always
How to prevent diabetes?
concern. Yes.
Okay, perfect. I want to start by disabusing you of a concept that is very common, very well agreed upon, that there's such a thing as diabetes, as a separate entity, and such a thing as high blood pressure as a separate entity, and high cholesterol, and arthritis, and sleep apnea, and so on. People believe that such entities do exist because there are doctors who specialize in these things. There are many different meds that are designed to treat these conditions. And sometimes you have one and not the other, so they must be separate entities. Some people have nothing but diabetes or nothing but high blood pressure, and so on and so forth. All of these are manifestations of the same disease. And because of the way medicine is practiced, the way healthcare is structured, we don't look at these different entities, seemingly different, as one disease. How do we know that they are one disease? Because if we fix what we believe is the cause for all of these, which is a set of conditions that we create, either within the body or in the environment where the body exists, all of these disappear. So you can have one of these conditions, which we refer to normally as chronic disease, chronic condition, because most people, when they have one of these conditions, they continue to have these conditions. If you're being treated for high blood pressure, you continue to be treated for high blood pressure. Normally, that's what normally happens, you see, which makes no sense, which also tells you that focusing on high blood pressure doesn't fix the problem. There must be some other problem, some more of an underlying situation that's being missed. But if I specialize in high blood pressure, then I see patients only for that, because I'm expert at helping you control that, then I'm not going to be looking at the other conditions necessarily. And I'm not going to be looking at the underlying condition or situation or lifestyle or behavior or that may be the actual cause of it. I will just focus on treating it. You see, not curing it, only treating it, you see. So, and that's been what's going on, and most people do not expect a better system because they don't know that it's even possible. Because you go to your doctor and the doctor says, you have high blood pressure and we need to give you something for that. What are you going to say? You see, you don't have the same level of knowledge. You can't argue with your doctor. If you say, but I don't want to take medication, I don't like to put drugs in my system, he's going to go, what else are you going to do? It's going to kill you if you don't do that. And then you're going to go, okay, I guess I'm going to take that med. So what we have been discovering year after year after year after year here at this office is that all of these conditions can yield really quickly, sometimes within a week, most of the time within 3 months, almost always within less than a year. And by that I mean people don't have those conditions anymore, and therefore they don't need to take medication for them. You see, which is very significant, very significant. And the system that we have devised to achieve that is a system that works with your doctor. The moment you're here, with your permission, we collect all of the information that we have on you and the program that we want to put you on and so forth, and we send that to your doctor. Hey, Dr. So-and-so, your patient is here. This is what we're doing with them. We would like to schedule them more often than ever because you're going to have to remove some of their meds. Initially, maybe just reduce the meds and then remove the meds. So we don't want them to be taking medication on the assumption that they're sick, because now they're no longer that sick. And maybe seeing them once every 3 months and then once every month would be very necessary. And that's what happens normally. And people end up without medication. If you were to stop taking medication on your own, you would be creating a lot of potential danger. So you should not be doing that. But you should consider every possible way to stop taking medication with the help of your doctor. And the only way your doctor is going to agree with this is when you don't need it anymore. You see? And sometimes when you don't need it anymore, they keep you on a small dosage and ask you to come back in a couple of 3 months just to be on the safe side. Because what is the doctor's intention for you? To be healthy. But the way medicine is structured and healthcare system is structured, it doesn't actually work that way. The intention of the doctor is very clean, but the tools offered are very limited. And therefore, we spend more money on healthcare as a nation than any other bill, period. It's our #1 cost, you see, which really is not okay, because there are ways to reduce that very significantly. And with that, suffering, and with that, increase your lifespan. And we're not talking about adding years to your life, just any kind of years. We're talking about adding healthy years to your life. And of course, there's a lot of research to support this. In the past, we did not have enough research, substantial research, to support this. We just saw that clinically. We see that people are getting better. And we start analyzing, why would they be getting better that quickly? You see, there are centers right now where someone who's been taking 10 different types of medication to a hospital, where you would be admitted